Today we will be talking about how ginger is medicine. I frequently get motion sick in vehicles, and like many others who similarly get motion sick, I have become accustomed to using ginger to get rid of my nausea, a well-known treatment for motion sickness and nausea in general. Ginger has also been tested for its usefulness in helping chemo patients regulate nausea and decrease nausea, as well as helping with morning sickness symptoms of nausea and vomiting. This video, though, will focus on its utility for functional dyspepsia, which is a fullness after a meal that may manifest as abdominal pain or discomfort. Functional dyspepsia and otherwise unexplained nausea can be due to postprandial antral hypomotility, or in other words, a lack of movement and muscle contraction in a lower section of the stomach that occurs after a meal. In 2008, Wu et al. Published their findings on the effects of ginger on gastric emptying and motility in healthy humans. They had these humans ingest ginger and 1 hour later ingest soup and measured their antral contractions, antral area. And they found that ginger accelerated gastric emptying and stimulated antral contractions. You can see in this bar graph where the black bars represent when ginger was consumed as opposed to a placebo being consumed. You can see that there are more antral contractions throughout the entire time span measured in the people that consume ginger. So if you eat too much and feel nauseous, maybe have some acid reflux or bloating, there's probably not enough muscle contraction in your lower stomach, and ginger appears to stimulate those contractions so that your meal can get emptied into the small intestine and relieve that discomfort and nausea. Gastric hypomotility involves temporary dysfunction of cholinergic M3 and serotonergic 5-HT3 and 5-HT4 receptors, which can be modulated by compounds found in ginger root. Some of these compounds which are abundant in ginger are 6-gingerol, 8-gingerol, 10-gingerol, and 6-shogool. Studies have specifically found that gingerols and shagools weakly inhibit M3 and 5-HT receptors, but they found that this is not a direct inhibition. Regardless, they think that this may be why ginger is so efficient at reducing nausea and vomiting. So, an antagonist is a molecule that inhibits the function of a receptor. And 5-HT3 is a serotonin receptor found in the vagus nerve, and it's involved in communication between the gastrointestinal tract and the brain to cause the experience of nausea and vomiting. 5-HT3 antagonists are considered the golden standard for treating nausea and vomiting in cancer patients undergoing chemotherapy, as it inhibits or blocks the function of these receptors, and therefore inhibits and blocks the communication of nausea and the signals for vomiting. Though 5-HT3 receptor agonists may be the golden standard for anti-nausea and vomiting, drugs like this are not always the preferred option for pregnant women experiencing morning sickness, as it could have potential toxic effects on the development of the fetus. This is one of the reasons why ginger is such a great option for nausea, because these naturally found compounds are in something that we could eat with meals. It shouldn't have negative toxic effects on a developing fetus and could help a mother with her morning sickness. Additionally, if you have functional dyspepsia, as previously mentioned, you wouldn't want to have to get a prescribed medication from a doctor. So it's wonderful that we have these studies to show us that ginger can help us in a similar way as these 5-HT3 antagonists.